So for today's video, the last video for chapter 1, I'm going to briefly tell you about a few key vocab words. Now, science is like learning a language, so it's going to take time and practice for you to feel comfortable with this vocabulary. And the best way to do it, old-fashioned flashcards. Take note cards, write them down, study them when you can. The act of writing the note card is actually the most important part, which is why I recommend note cards over Quizlet. A lot of research has shown that physically writing things helps you a lot more than just passively looking at things. The other key with note cards is to say them out loud to yourself, because a lot of people are auditory processors. With that in mind, let's jump right in. So the first term you need to understand is anatomical position, which is the standard body position. Standing straight, feet parallel, arms at your sides, palms face out with your thumbs facing out. And so this is important because this is the reference point that all people in both medical and research, all anatomy people use the anatomical position as their reference point. And so if you are not talking about the same reference point, then it doesn't really matter what you say for medial versus lateral or any of these terms if the body is not in the right position. So anatomical position, gotta know it. Now, I'm going to show you a bunch of charts with some vocab words for direction. Again, it's just going to take practice. Superior means up, means towards the head. Inferior, towards the feet. I'm not going to test you on cranial or caudal. You do, however, need to know both words that mean front and back, so ventral and anterior, dorsal and posterior. For this, I usually remember it by the words that mean back and then know that the opposite means front. So dorsal, I think of dorsal fin, like a shark, and then posterior meaning butt, so the back side. Medial, towards the middle, whereas lateral is towards the edge. Intermediate is going to be in between. And then proximal is a word we use only for our limbs. So with our limbs, we're talking about closer to the point of attachment. So our shoulder is proximal to our elbow because it's closer to the site where the arm attaches to our body. Whereas distal, meaning further away. So our hands are distal to our elbow because they're further away from the spot where the arm attaches to the body. Superficial, towards the surface. Deep, internal, it's further away from the surface. And then you need to know all of these words that mean body parts. We don't just say arm, right? We have words that we use for arm, like brachial. We don't just say frontal, we don't just say forehead, we say frontal. So you're going to have to know all of these vocab words, okay? So you need to know directions, you need to know vocab words. Make flashcards. Spend time with this now. Again, this is our anterior view and our posterior view. Words for body parts. You also have to know anatomical planes. Anatomical planes are important because that's when we get images, we're getting them in a certain plane. So a sagittal plane is going to cut a body in the middle. A mid-sagittal is exactly in the middle. A sagittal is going to be anywhere along that axis. A frontal plane gives you a front half and a back half. So it's going to be slicing it right through the middle of your head. Frontal, front half, back half. And a transverse plane gives you a top and a bottom. Got to know your three planes. You also need to be familiar with your body cavities. So the dorsal cavity holds the cranial cavity for your brain and the spinal cavity for your spinal cord. And then the ventral side is going to be all that stuff in the middle. So your thoracic cavity is for your lungs. The abdominal cavity is for all of those inner organs. And then your pelvic category is for your reproductive organs. You can also talk about quadrants. Now, for quadrants, this is mainly used when we're talking about stomach pain. So it's important to know, for example, if you're working in a medical facility and someone comes in and they say they have right upper quadrant pain, that means something very different than if they have lower left quadrant pain. Okay, so I want you to think about maybe why is that? Why is it important to know exactly where someone's stomach pain is? Think about it. Think about it. Okay, so that right upper quadrant pain, different from left upper quadrant. And what is important about the quadrants is it's from the patient's or the person's perspective. So it's not you looking at the body, right? It's the person themselves. Same with body regions. For body regions, this I'm not going to test you on too much. You might see maybe one question, but epigastric is going to be up, umbilical is going to be in the middle, hypogastric or pubic is going to be low. And then you've got the iliacs, the lumbar, and the hypochondriac. So those are your body regions. Okay, and this is where the organs are in some of those body regions. Okay, So you want to be able to quiz yourself about planes, sagittal, coronal, or frontal, and transverse. And then you want to be able to complete these sentences. So the hands are what direction, superior, inferior to the feet. The way that I like to approach these problems is I say it in plain English first and then think, what does that mean in anatomy terms? So the hands are above the feet. Which one of those words means above? The knees are below the waist, which one means below? The elbow is above the wrist, etc. Same with anterior versus posterior, lateral versus medial. Okay, so in this video, we finished covering some key vocab words. You are now ready for your first case study or first activity, and that will be in either in person or digitally, virtually, depending on your group.